While many of COVID 19's symptoms infuriatingly mimic that of the flu or a cold, the loss of taste and smell have been a common indicator of the virus. New research now estimates between 700,000 and 1.6 million people may not have regained their sense of smell even months after their COVID infection. And health professionals are researching ways to help patients regain these senses. Joining us now to share tips on how to recover from smell loss is Dr. Peter Papagiannopoulos, a specialist who treats smell loss and sinus problems at Rush University Medical Center. Doctor, thank you for joining us. So, as I mentioned, we know that the Omicron variant's symptoms have been much more cold-like, the sniffles, sneezing, and such. Does Omicron have the same impact on smell and taste as we've typically seen with COVID-19 up to this point?
Well, thank you so much for having me, first of all. And I'd say in terms of Omicron's long-term effects, a little bit too early to tell. It anecdotally seems to me like it's still having some similar effects, at least in the short term, as it has for the prior variants.
Okay, so with Omicron, as we mentioned, cases or symptoms can closely resemble flu and cold. How should we manage this as cases, as cases rise and then later on as they go down?
I think the key is to do the simple things, to continue to kind of wear a mask when you're in public, try to limit your exposure to, large public spaces and being in large groups. Reality is this does spread amazingly quickly and amazingly easily. At least I myself have had numerous, friends, catch it in the last month or so. So I think even anecdotally, it's very clear that this is spread much more easily amongst us.
Okay. Now, according to a study from the American Journal of Otolaryngology, over 72% of patients with smell loss recovered after 1 month, and 84% of patients with taste loss also recovered after 1 month. What do we know about what causes this dysfunction?
Yeah, it's a great question. So smell and taste are very, very much interlinked. So really, when we talk about taste alone, there's only about 4 cardinal tastes: sweet, sour, bitter, and umami, or that's kind of the meat flavor. Every other element that we get in terms of flavor comes from your sense of smell. So when people have a smell loss, they almost certainly have a taste loss as well. What we've found, and your numbers are correct, are that usually of those patients with COVID who have a smell loss, about 85% will be back to normal at about 1 month. That leaves about 15% of patients that will be struggling potentially for up to 3 months. And then there are patients that never really get a normal function back, unfortunately.
And what do we know about how it can be restored?
Yeah, so the reason for the loss is actually, rather than a swelling problem in the nose or a congestion problem, really it's a problem at the level of the smell nerves. It is actually nerve damage, is an easy way you can think about it, caused by the virus. So what we can do early on is what's called smell retraining therapy. And I recommend starting this therapy if you're still having smell dysfunction symptoms 2 weeks into COVID. If you're still having issues after that, the earlier you start this, the better.
And what does this therapy entail? And is it the kind of thing that I can just do on my own at home, or should I see someone like you for that?
It's a great question. And I would actually, I think it's something you could start, on your own. It's fairly easy to do. It requires using essential oils. We usually recommend 4 different essential oils you can buy, on any online site. The 4 recommended are lemon, rose, clove, and eucalyptus. Really, they should be smells that you know what they're supposed to smell like, because a lot of the difficulty with this smell loss is trying to reconnect basically the nerve connection between what your memory of what it smells like to what it actually smells like. So the way it works is you'll put each of those smells in front of you in the morning, and for 15 seconds, you'll put that essential oil right in front of your nose, take a deep sniff in for 15 seconds, put it down, think about what that smell should smell like and compare it to what it actually smells like, and go down the line. To do that morning and night. And if you're still having issues, I would say come see an otolaryngologist, as soon as a month after your diagnosis, so that we can start working with you.
And you mentioned also, a small percentage of people who still never regain that sense of taste. And for some people, something doesn't taste the way it used to before they had COVID. But what are your concerns there about what can be done for people who may never regain that?
Yeah, that is true. It is a minority of patients. I'd say it's about 5%, but it is real. I've had a 30-year-old chef in my office, crying that he can't really perform his job the same way he used to. So the biggest way we can avoid a long-term effect is avoid getting it as much as you can. It's hard to predict who is going to have a long-term smell loss and who will. Really, the key is that if you do yourself have these symptoms, the sooner you can start smell retraining therapy, the better chance you'll have of avoiding long-term effects.
Okay, that's where we'll leave it. Our thanks to Dr. Peter Papagiannopoulos for joining us. Thank you.
My privilege.